everybody.
I'm Dr. Raul Rosas. I'm the physical therapist from Ready Care Physical Therapy. I'm here today to show you how our home care physical therapy works. This is my friend Fernando. He's a patient of mine that I've been seeing for a while in the home. As you can see, we're not in a clinic, we're in his apartment. With home care physical therapy for us, we go through Medicare Part B, not Part A, and each session with each of our patients is about an hour long. So we try to tell people that we're not here just in and out, do a couple of exercises and leaving. We do a lot of different things like functional training, massaging, exercises, and gait and balance training, whether it's outdoors or in the house. So you'll see with the following clips a couple of the different things I'll do with Fernando, and just to show you that we're more than just the exercises and what people normally think of how home care physical therapy is. Talk more about Fernando. He is a patient of mine that I've been seeing for the past year or two. He suffered from a stroke a couple of years ago, and as you can see, it affected his left side. A lot of the things I do with him are more functional training, getting in and out of bed, working on standing up, sitting down, and as you'll see later on, walking outside and up and down the stairs. But a couple of the things that I do inside the apartment, other than the usual exercises to strengthen his arm and his leg, are I do a lot of stretching. And for him, a big part of his issue is his left arm being very immobile, very flaccid, and it can get very tight, with also symptoms of regional pain syndrome on the left side. So I do a lot of the active assistive range of motion. I would direct him to raise your hand as high as you can while I stretch him out. And judging by his reaction or what he tells me, I'd stop, hold it. Now we do this for at least a few minutes. You always want to make sure you stretch out all parts of the shoulder. The other part of the stretching, the manual therapy, is that, especially for someone like him, I do a lot of work to his posterior trap and his posterior deltoid, because that tends to be a very important area to work on for post-stroke. It helps aid in the stabilization for the shoulder and moving around. So I do a lot of massaging up into his upper trap, down into the shoulder blade, scapular region, and then as well as some joint mobilization.
I think the scap is where the most painful.
Yeah, that's where it's the most painful. So for him, with that kind of pain, us as physical therapists should know what else can we do other than the manual therapy. For him, we'd also work on the scapular stabilization, so any retraction exercises and such. In the next clip, you'll see me work with him on the balance and gait training as well as the stairs.